Well, hello everyone. Hopefully you can hear me. My name's David Pearson. I'm a director with the Australian Alliance to End Homelessness. So thank you very much for logging in today to be part of this forum. Before we get going, can I just acknowledge today that we're all in different parts of the country, but we do all meet on Aboriginal land and we pay our respects to elders past, present and emerging. I think an important recognition to make in the spirit of reconciliation, but also recognising we're here to talk about the issue of homelessness and this latest crisis, and that our First Nations brothers and sisters around this country are dealing with the intergenerational effects of the trauma that was caused by the dispossession of our first peoples from their land and their homelessness created by the nature of Australia's founding. So an important recognition to make at the beginning of this session. But of course, wanted to welcome you all for being here. We have a very broad cross-section of people on the call, friends from the media, but also people from the not-for-profit sector, local government and many other places. But I'd also like to recognise that we also have Minister Luke Howarth on the call as well, the member for Petrie, and the Assistant Minister for Community Housing, Homelessness and Community Services. So thanks, Minister, for being part of this call and listening to our experiences as a sector and what's going on and the sharing of information. So there's a few things we'll cover today and I'll take you through that, but I just did want to acknowledge that we are in unusual times. We're all calling into this call from our homes. This is a quote that I found quite interesting from the Special Rapporteur on Housing recently. And I really want to acknowledge the time that so many of you are taking out of your days to be part of this forum. For those who are in homes, those who are supporting people who are sleeping rough at the moment, you are on the front line of this crisis. You are putting yourselves in harm's way. And we wanted to acknowledge that right up the front to say thank you for the work you're doing. It is so important to help some of the most vulnerable people in our community. So we really appreciate you being here. It's taking the time to be part of this, particularly all the panellists as well. So for today, we're going to tell you a little bit about the Australian Alliance and why we've called this forum. We're going to release a health and homelessness paper that we put together before this crisis came along, but Karyn, the chair of the Australian Alliance, is going to speak a little bit about that. And then we're going to hear from a range of experts and leaders in each state and territory across Australia about what's going on, what are the challenges they're facing, and we'll have some time for some questions at the end. And we've got Professor Paul Flatau from the Centre for Social Impact at the University of Western Australia, who's going to say a few things as well to sort of pull together some of the common themes we've heard and talk about some of the work he's doing. So that's the plan. So just quickly about the Australian Alliance, we're a network of organisations that are supporting communities to end homelessness. And we fundamentally believe that homelessness is not an issue that needs to be reduced or managed. It's an issue that we shouldn't have in this country. We think that it is manageable. The scale of the problem is manageable, and we think that in order to better define this challenge, we think that the homelessness should be rare, brief and non-reoccurring. That's our definition of what an end to homelessness looks like. And we've been working for a number of years around the country with a range of different organisations. We've built and developed a number of tools. So registry weeks or connections weeks, which many of you might have heard of before, are a useful way of making sure we actually understand the names and the needs of everyone in our community who's sleeping rough. And you'll hear how powerful having that understanding has been in responding to this crisis is from some of the panellists later on. We've also developed an Australian version of the VI SPDAT, which is a common assessment tool which some people may be familiar with. If you're interested in more of these resources, you can find them on our website. But we've also worked with a number of communities across Australia to support the campaigns they're running. And these are just a few of them that have participated in the training programs and the action labs, as we call them, as part of our Advance to Zero project. So that's the work that we do. It's very much focused on ending homelessness. And I wanted to briefly just mention the functional zero approach, some people call the zero homelessness approach that we're using. It revolves around measuring the homelessness system. What's going on? How many people are in that system? So starting with a bind list, using your connections weeks or your registry weeks to understand that, and then tracking over time. How many people are we moving into housing? How many people are going active? How many coming back into the system? And this is how we measure it. There's a whole range of data measurements that underpin it all, but this has been so important to responding to this crisis because knowing who the people that are sleeping rough are means that we can do something about it very quickly when the will and the action is there. So many of the speakers will talk about that shortly. But also, as I mentioned, we have released this health paper. So I might throw to you, Karyn, to say a few words about that if you're there.
I'm here. Hello, everybody. I too want to acknowledge the traditional owners of the land, elders both past, present and future. And in relation to our paper, Leaving No One Behind, just acknowledge right up front the enormous health inequity and the close the gap measures that are still so important for First Nations people, but also the leadership of the Aboriginal and Islander, Torres Strait Islander medical services, who have for many years been showing a different way of making sure that health equality is something that we all work towards. So over the last 10 years or so, there's been different models across Australia of healthcare being such a critical factor to addressing and ending homelessness. So in 2018, we called together a round table, and we had over 60 people and more have contributed through emails over that time to put together this paper, which you will see in the latest edition of Parity as well, just to advocate that we really do need greater collaboration between health, housing and homelessness, because it's integral to both the needs of people on the street, that people aren't left behind, and that deaths that could be preventable can be prevented, and that people can be given resources, healthcare, nursing, GPs, hospital to home programs, that people who have experienced chronic homelessness or any form of homelessness, because sometimes we're finding now people have recently not necessarily been on the streets for long periods of time, but are very unwell and are on the streets due to a whole range of circumstances, including discharge from hospital or release from prison. So it's really important, and I think I was reminded of this so much the other night, that I know across the country, PHNs have funded nurses to be integrated into homeless teams, or specialist GPs have been working with nurses, or the hospitals like St Vincent's have played their role around outreach to homeless people. And what we've got is a mix of really good emerging practice, and we know that every city, it's mainly been in capital cities at this point, but it is very much replicable in smaller cities. But what you need to work out is what's the ecosystem for each community of how greater access to nursing care, integrated care with GPs and linkages with the hospitals can occur. So this paper's just put together a briefing paper really to highlight that this is an emerging area that we all need to continue to talk about, that people are doing great work across the country that is really new, and some of it has been around for a long time but has never been given the profile. And the other night when I was out at the van with our team, just looking at how things were going, it just was amazing to see the benefits, and who would have known that we would be in this position with a national pandemic health crisis. But just to see the value of having nursing and social services working close together, that, in the one sort of intervention, we had hand washing stations, distribution of food, people having their temperature taken, which made an enormous difference to their anxiety levels and diverted people from going to hospital because they thought they had a fever or wondered if they had a fever. And I'm sure there's lots of examples of nursing care that we know is so critical to enabling people to be housed and to stay housed. So we hope that we can share more information across the country about these practices, and today we're focusing on the COVID virus and what people are doing. And I'm sure these initiatives with healthcare have been a critical part of developing our response.
Great, thank you, Karyn. Well, I just wanted to remind everyone that there's a chat function on this call that we're doing today. So please feel free to hop on there and ask questions about anything you want to do when you're hearing from speakers. So you can get on there and post some questions, or if you hear something and you want to make some comments, please do it. We've got almost 400 people registered for this call today, so we can't have all of your video and you being able to share on. We've only got the panelists able to talk, but you can please participate through the online chat feature that you can find down the bottom. So yeah, with that said, also just wanted to remind everyone that there's a chance for questions at the end, but do pass that as we go along. So first speaker, I guess, is Andrew Darcy from Launch Housing in Victoria. So Andrew, I'll give you a chance to say a few words about what's going on in Victoria.
Hello, thanks for inviting us. I'd like to acknowledge the traditional owners of the land as well that we work on today. I guess my name, I should let you know, Andrew Darcy. I work for Launch Housing. I'm the general manager of Getting Housing. A lot of our services are for people who are currently without shelter at all. We run crisis services, homeless entry points, a large assertive outreach team, children's specialist services, and we also do the street counts in Melbourne. We're a large secular organisation, and our mission is to end homelessness. We've been a founding member of the Australian Alliance, and we're really keen to be part of this today.
Andrew, do you mind just turning your video on so everyone can see you?
Can you not see me?
No. There you go. Thank you.
Okay. So what's happening in Victoria? Victoria's state of emergency was declared on the 16th of March. Last week, the department gave us some really useful guidelines to assist us in responding to the COVID-19 pandemic. Really practical assistance around how we can continue and even expand our services during the crisis. We've had significant impact on our services, as you would imagine. Our entry points do remain open, but we've had to adjust how we do things. We're doing more work on the phone, but we are still open for people. Our assertive outreach has increased. We're seeing an enormous amount of people. Our crisis accommodation continues to be open, but we've put in quite extraordinary measures. We're not having people visit our sites. We've got teams working in hive teams in case we do have an issue. And some of our other teams are working from home where that's possible, but our assertive outreach are out there on the streets. We've also got a lot of families living in motels, isolating. One thing that we have done is our specialist children's service has created a hotline. So children and families that can't get out of the house can give them a call for some emotional support or some activities. In terms of assertive outreach, what I really wanted to focus on today, it's really critical that we get out there and we stay out there on the streets, of course. People are screened not just for their emergency accom, but we've got nurses who work in our teams. Bolton Clark nurses have been pivotal in ensuring that people are confident with their health. We've received a lot of additional emergency accommodation money from the state. They've doubled our money over the last 3 months. That's allowed us to bulk purchase accommodation in motels, and we're putting people in motels now for upwards of a month. We've just got to keep people off the streets at the moment, and that's been really valuable for us. We've had some amazing outcomes in the last week. Last week, my 20 assertive outreach workers, they got 280, let me see. Yeah, 280 people off the street in a week, which was extraordinary. They're out there 7 days a week, and we're expanding that service. We're also giving out food. We're giving out masks, sanitizers. Food for pets has been something that we've had to plan for. Amazing the amount of people that have got pets on the street. We're building an assertive outreach team at the moment to assist with this, especially for people. We've got a real worry that as we're putting people in emergency accommodation, we're really worried about what's going to happen at the end of it. So we're doing everything to get people off the streets, but of course, what happens when they're in there? Our assertive outreach teams are continuing to plough on the streets, and we're developing another team to ensure that those people in emergency accommodation are well supported. There's the state have announced that there's going to be some quarantine centres for homeless people experiencing homelessness. We're working on one of them at the moment. It's going to be a mix of housing, specialist housing support and homelessness support, and clinical hospital staff. It's very, very valuable. If we do have an outbreak in one of our facilities, it's going to be very, very difficult. So when we can get these quarantine services stood up. That's going to be a big help. Touch wood though, we haven't had a confirmed case of COVID in the Victorian homelessness system as yet. So that's really good news. What we're seeing is where we've got a zero program in Port Phillip, and what we're finding is that in areas of Melbourne where we're working closely and we've got a lot of coordination happening, then the work to get people off the streets and to keep them supported is a hell of a lot easier. So what we're finding is that we've already got all the infrastructure in place when we've got the functional zero, or we've got tight coordination, and we're finding that the support that we're all giving each other in the sector has just been extraordinary. Our nursing partners, Bolton Clark, have offered us additional nursing support on the streets. We're in health services. We're putting staff in. We're sharing staff. It's been extraordinary actually how everyone's working together. We were due to deliver a 7 municipality street count across inner Melbourne in June. Now that's been mothballed. We're expecting to do that later in the year, but that will still go on. I guess the key challenges for us, of course, are providing a safe working environment for the staff. Asking our staff to go out when everyone else is being asked to stay in is a challenge. Making sure that our staff feel well, that they feel supported, is a huge challenge that we're working on. But also, of course, making sure that the most vulnerable people, the people who haven't got anywhere to live, are prioritised and do get housing. What would we like more of? I guess we would like more forums like this. We learn so much from other partners across Australia. We're all working on the same things. So more forums like this would be fantastic. We've got to keep innovating with our housing. And what we've really got to do now is we've really got to plan to ensure that all of these extra people that are in emergency accom have somewhere long-term and safe to go at the end of this pandemic, so they don't just return and we have a devastating churn in the system. What we think we need to happen in the future is, as I've said, it's so clear that having decent coordination really assists in an emergency. So we'd like to see by name lists across Melbourne and across Australia. And I think just the final thing to say is that the pandemic has really shown community that people experiencing homelessness are just like us in a way that we've fought with for years. So the community, we all need a home, we all need healthcare, we all need to be in the same community, otherwise none of us are going to be safe. So I think this pandemic can give us some real benefits moving forward in trying to end homelessness. That'll do for me.
Great, thank you very much. So we'll save questions till the end, and we'll just keep working our way through. Sorry, just sharing my video. We'll keep working our way through all this. So thank you very much for that, Andrew. So John Berger from West Australian Alliance to End Homelessness. Can I ask you to say a few words and turn your video on and share your thoughts?
Yep, I'm happy to come online. I'm pressing the start video and it's not allowing me to. It's telling me you need to switch me on. So anyway, I'll keep going. Yeah, look, I'd like to echo Andrew's comments. There's been great rallying and support across the community. I'm here from as the Executive Officer for the WA End Homelessness Alliance, and I'm standing in for RUA, who have supported and maintained its connection to the Australian Alliance. The WA Alliance formed in 2016 and initially made up of 8 agencies, and is now made up of both housing, homelessness, lived experience, community and corporate entities. The WA Alliance has Shelter WA as its backbone agency, which allows us to be active and working in this space. After launching our 10-year strategy in 2018 to end homelessness, we went on to support and inform the state government 10-year strategy, which was released in December 2019. Importantly, along with this came a commitment to funding $35 million for Housing First, 2 common ground builds, and $150 million for more social housing. And I'll link why this is important as we go further down. RUA, who's been the backbone for the 50 Lives, 50 Homes, the registry weeks, and more recently, the Advance to Zero through the implementation of the by name list. So in mid-March with the COVID situation coming on board or coming on deck, the sector, led by Shelter WA, came together to form a working group to act as a conduit for tabling and addressing issues as a result of the impact of COVID-19 across the sector. Soon after, the Department of Communities announced a number of task forces around vulnerable cohorts, including those experiencing homelessness, and it was agreed that the sector, along with government, would merge into one group called the Homelessness Task Force. We quickly formed into various task groups to address the variety of issues raised. These groups were made up of staff across the NGOs, government and Shelter WA. Above the task force is an intergovernment partnership group and an incident management group. And then above that is the Department of Premier and Cabinet, along with Health, who also have a statewide incident management group. Part of the challenge has been finding who's doing which bit, where to join them up, and where to escalate issues for decisions and actions. However, the sector remains strong in its role for advocacy. With regards to rough sleepers, the task force agreed to adopt a health approach driven by the research and knowledge of Dr. Lisa Wood, a public health in UWA, and Dr. Andrew Davies, homeless healthcare, as we quickly adapted the UK approach of COVID prevent, COVID protect, and COVID care. The case for this was based on the modelling from the UK, which suggested that 70% avoidance of projected emergency department and hospital admissions could be achieved by a comprehensive plan is implemented, which includes targeting accommodation and to isolate those that are vulnerable. Perth Metro has over 700 rough sleepers per night, and it's estimated at 400 in Greater WA, and not to mention those in overcrowded housing. An analysis of homeless healthcare patients also showed that 33% or 34% of homeless people who have been treated in the past 12 months have one or more high risk factors for COVID-19. Therefore, the response is based on those vulnerable individuals that are classified by the COVID prevent, protect and care approach. And this cohort analysis and triage system has been developed and trialled. To support this approach, we commenced the Hotels with Heart hotel accommodation and received endorsement to begin with a short trial of 20 beds at the Pan Pacific as a COVID protect response. That was people who presented with COVID-like symptoms were being triaged and admitted into the hotel for isolation whilst they awaited the test results. So far, they've housed 27 people, and we've submitted a request for a greater expansion of this approach. In the meantime, a further 30 to 40 rough sleepers have been sponsored into other hotel-style accommodation while we are awaiting approval for further funding. This has been a response to those individuals who felt unsafe within their current street environment, and needless to say, we're feeling the pressure of needing to progress on this. While we're awaiting a decision from the department, the government has announced that Lottery West will provide an initial offer of 59 million for COVID, with a further 100 million becoming available beyond July 1st. Grant opportunities have just opened up and will help absorb some of the pressure points. The second main approach that's been agreed to and being adopted by the Homelessness Task Force has been called Housing and Support, by seeking to rapidly accelerate the Housing First program, which, as I mentioned earlier, has $35 million funding attached to it, to seek to house each rough sleeper and provide wraparound support. This will entail exploring all avenues for accessing affordable and appropriate housing, including subsidised rental housing, and building the support model to ensure that people can sustain their housing. This is all work in progress. We are seeking to link short-term housing straight into longer-term permanent housing and avoiding the use of transitional housing. We, or should I say Leah Watkins from RUA, has developed a systems map which seeks to identify the flow of rough sleepers through these approaches. This map has assisted us to understand which elements require development or bolstering to allow for the expected numbers coming through. Therefore, the by name list, which has been early in its implementation, is now being accelerated in terms of agencies signing up people being trained and people being registered on the database. We all know that this is crucial in knowing the numbers coming through, identifying who has been supported, and knowing where they're being accommodated and tracking their progress. This will ensure that we have a whole systems overview of how we will be tracking. We're also supporting the establishment of a COVID care clinic for those people with COVID, but do not require hospitalisation, with the aim of providing self-isolation as well as access to healthcare and support. This clinic will seek to mitigate the demand for hospital admissions. There is other work being undertaken via other cohort groups, particularly those in overcrowded accommodation or in congregate care, and we're developing the capacity to support self-isolation, and where that's not possible, providing appropriate alternative accommodation. We've also been responding to sector issues regarding appropriate guidelines and information through the production of information leaflets, webpage, webinars, PPE, safe transport, volunteer registers, and not to forget food relief. There's been a rapid reduction of many volunteer-based services. So some of this has been addressed by whole of government approaches, and others have been more specialised towards the homelessness sector. All of this has only been possible by the tireless work of a range of individuals and agencies, including the Department of Communities, Shelter WA as the Housing and Homelessness Peak, and a range of other peaks, agencies and organisations. In summary, we are seeking to provide a strong health response in the immediate future through temporary housing, and then using the scenario to link to our longer term strategy for housing and support. We would like to ensure that temporary accommodation is for the shortest period possible. We all agree that affordable and appropriate housing is the frontline defence to against COVID-19. The sooner we house and support people, the lesser the impact of COVID-19. Thank you.
Thank you, John. That was a wonderfully positive presentation about a very broad range of things you're doing in Western Australia, so congratulations on that. Kim Holmes from South Australia and Neami National, do you want to turn your video on and share with us what's going on?
I am unable to start my video because the host has stopped it.
Okay, we'll sort that out if you just keep going, Kim.
Okay.
Sorry.
Here we go. I think that's working now. So
Yeah,
thank you very much for the opportunity to share what we're doing in South Australia. I'm Kim Holmes. I'm State Manager in South Australia for Neami National. For those of you that don't know Neami National, we're a specialist mental health service, also supporting people with complex needs, and across the country are certainly working in a number of states supporting rough sleepers. In 2017, Neami commenced delivering the Street to Home service in South Australia, which includes street outreach, a hub, case management, a primary health team, and post-crisis support. So this is what we are leveraging on in the coordination of this response in conjunction with the South Australian Housing Authority. The other very important part that's been an amazingly strong foundation for us being able to do the work here has been the Adelaide Zero project, which is the collective of government and non-government agencies working towards zero homelessness in South Australia. Neami plays a number of roles in that, but part of our responsibility has been the establishment and the managing of the by name list, and we're an active member across the collective. So our focus has been rough sleepers and the emergency response to accommodating those rough sleepers, particularly focused on the inner city Adelaide and surrounds, where there's the highest number of rough sleepers in South Australia. We've been learning as we go, and this has rapidly unfolded. As I said, we've been coordinating this side by side with the South Australian Housing Authority. We've also partnered with Baptist Care and the Hutt Street Centre And there's been a broad range of other agencies that have made what we've done work. I'd also mention that Service to Youth Council and youth-focused agencies have a specific focus on young people, and there's also 8 young people that have been accommodated in hotels and motels in the surrounds of the city. This was kicked off in a broader emergency response that has been kicked off by the South Australian Housing Authority, who I'm going to call SAHA from now on. It includes some other strategies which I won't go into, which involve responses, a number of new responses to remote visitors that are visiting Adelaide, quarantine services, etc. So there's a range of other activities that are happening, which I won't speak to today, but they are all sitting around this response. The specific response that we have been involved on kicked off on the 24th of March. We've now accommodated 256 people as of 9:30 last night in motels and hotels in the inner city and surrounding the city. I would say the majority of those people were accommodated in the first 2 weeks, and we've seen a trend over the last few days where that number is sitting around the same level, which would indicate to us that the majority of people that are sleeping rough in the inner city are now, for the first time, in hotels and motels. We do know that there are a small number of people that are still on the street. These are individuals with complex needs, and I'll talk a little more about what we're doing with mental health and drug and alcohol and a range of other services to reach and continue to work with those people. This was kicked off because of that risk, the increased risk to rough sleepers to COVID-19 and other infections because of lowered immunity, often living in close proximity, not being able to practice hand hygiene or physical distancing like all other South Australians. This is why it was kicked off and part of the emergency response to enable people to put in place the same strategies as other South Australians. Alongside this, a spin-off benefit has been the amazing engagement from hotels and motels who have bent over backwards to support the strategy. Who were running at around, what they're telling us, around 10% occupancy, many of whom were having to close, put off staff. And so there's been a spin-off benefit to maintaining a workforce and businesses as well. There's been an amazing investment from SAHA, and all of this is what has clicked in to make this work. So what we're doing in terms of the model is this isn't just a free hotel or free motel for a period of time. We are very clear that this is an emergency response, and there's a number of elements to it that are all keeping sight of the longer term. So what is happening is that there are daily visits with every single individual in the hotels and motels. The way we've done that has been to divide that up across the agencies that are collaborating on this effort. Those daily visits include explaining expectations and responsibilities of the program and what the hotel expects. There's been a huge element of education. What we've found is that there was a really large number of people that didn't know what COVID-19 was, didn't understand what the restrictions were that were being put in place, didn't understand physical distancing, and that has been a significant component of the work that we've done in the early phases to ensure that everyone has the information to enact their own choices to keep themselves safe. The daily visits include troubleshooting, working with the hotel. They've done initial risk assessments. VI SPDATs have been completed. Our by name list is being updated, and the daily visits include connecting people in with their case manager. A large part of this has been the relationship and management and the support of the hotels. We're putting large groups of rough sleepers into hotel and motel accommodation, And so there is supports put in place for the hotels to enable them to enact what they need to in their hotel environment, and also manage some of the complexities that you can imagine have arisen. Case management. Every individual will inevitably be allocated a case manager. There has been investment in expanding the street to home case management team, and otherwise there are individuals that are already connected with our services and they continue on with their case management, or other agencies that have been working with the individuals. So critical part that case management has not stopped. In fact, there's been, as we continue on, now we've got majority of people in, there is a much stronger focus on case management and the long-term housing and sustainability of individuals, understanding people's needs. There is also a coordinated health response that we're bringing together. This has been with the hospital avoidance team, with Eastern Community Mental Health, and we're connecting also in with drug and alcohol services. This response is including our response to any symptoms that arise with COVID. We're coordinating a flu vaccination program, and we also have mental health connected in, particularly with those people that are experiencing high needs in terms of their mental illness. So there is a group of our agencies that are coming together to work together on that. Where we're at now is the longer term housing. We've started, SAHA have started allocating properties, and we've already started sort of moving people into some longer term housing. There is a long way to go. This is a large number. Consistently in the Adelaide Zero project, we've had approximately 150 active rough sleepers. We've got another 100 people that over 100 people that we weren't expecting. And so, as you can imagine, there's a great deal of work happening in how we respond to this larger group. As people are put into housing, they will also receive support to establish those houses, transition into those houses, and then supports put in place via Street to Home, via Hutt Street Centre, Baptist Care, mental health services, and other agencies, depending on the individualised needs. I've already spoken about the longer term solutions, and that very much is the focus right now. Some of the challenges that we've found is sustaining physical distancing in a hotel environment. People in small rooms with a bed, or we've really tried to source apartments that are far more sustainable. But if you think about you and I that have a home, physically distancing, we're doing things like home projects, and we've got our, you know, hobbies or whatever it is, our families or whatever it is that's enabling us to sustain physical distancing. Whereas in a hotel environment, that presents a number of challenges. So we're working hard on that. It's been an enormous stretch for all of the agencies that have been involved. It has been amazing, the collective approach, but it has been a massive stretch. In an environment where there's safety, there's high anxieties across teams, across individuals, and obviously keeping that big picture, the long-term focus when we've got the immediate needs has been a challenge. I know that my time is up, so I think the biggest learning for us has been that call to action, the collective approach that has been non-government, government, hotels, the community, and the positive response from the community has absolutely been pivotal in making this work. Not anything divisive, that it has been very much a collective approach. Look, I think I'll leave it there because I think my time is up, but I'm happy to, we'll be taking questions, I'm sure, as we go.
Great, thanks, Kim. That was really, really helpful and impressive, the numbers of people that have been housed, or sheltered, sorry, I should say, so quickly and in the process of being housed. So thank you very much. Shane from Neami in Western Australia.
Thanks, David. So I'm just following on
New
from
South
Kim.
Wales, sorry.
Oh, sorry, New South Wales, yes. Kim Holmes is one of my colleagues, and we work pretty closely around the street-based support outreach and post-crisis support in Neami. I'm a regional manager in New South Wales, and my patch is the inner city. So there's been a lot of media attention over the years around supporting people sleeping rough in the inner city, and I've been in the thick of that over the last few years. Neami has been operating the primary assertive outreach service in the inner city of Sydney for since 2010. So we've had a bit of skin in the game in relation to working with the population, with the cohort, with the services. And one of the things that's led to, I guess, the situation where we see ourselves now is that there's been a long-standing street count that the City of Sydney have coordinated. There's been long-standing coordination groups that have included government and not-for-profits and SHS sector, the Specialist Homelessness Service sector, which has meant that coordination has existed. And we are now at the place where we're in this pandemic, and we need to harness that skills and expertise. But just to give a bit of a snapshot, recently in New South Wales, last year, the Premier signed up to the International Institute of Global Homelessness Vanguard's approach, which is using the by name list methodology to coordinate support for people that are street sleeping. An entity called the End Street Sleeping Collaboration has been established in New South Wales, and a CEO has been appointed. So the work around that has started. The by name list has been trialled through a Connections Week, but is still in the implementation phase across the state. But certainly the methodology is at the forefront of everyone's minds. So what the difference with the Vanguard cities in New South Wales was, the Premier signed up the whole state to the targets, which is about eventually, hopefully, moving to reducing rough sleeping across the whole state. And what that has allowed us to do is harness multiple levels of government and departments within government to work together. So we have regular collaboration between Premier's department, between Department of Communities and Justice, which is the Housing Authority in New South Wales, as well as philanthropy, business, and the NGO sector. So we already had a pretty good base to work from. Let's sort of track forward to COVID-19. The pandemic hit. We already had a situation where with government, we were moving people off the street into temporary accommodation. So that would be hotels, and the government had released the part of the bureaucracy around limits for people stay in temporary accommodation. And that was a really important factor, because it meant that we could get people into temporary accommodation, and then Neami, with our post-crisis support team and other agencies, would then support people to complete their housing applications and move into longer-term housing through social housing offers or community housing providers. So we had a mechanism where that was already occurring. So now we have a situation where we've made a commitment to move everyone that wants to off the street into temporary accommodation. The government committed 300 temporary accommodation places in Sydney, in Greater Sydney, initially, 100 for Western Sydney, Greater Western Sydney, and they're almost full, 200 for the inner city, and as of today, this morning, we had 135 of those filled already. So if we put that in context, just in the inner city, the February 2020 street count saw 334 people sleeping rough in the inner city. So, you know, if you think we've housed 135, we're still a long way away from being able to get everyone that wants to off the street. And so additional TA is going to be required there. How we're coordinating in the COVID pandemic environment is that all parties have come together, and we've, again, like other states, have established a task force, which includes government, NGOs, the local health districts and the St Vincent's Health Network. And we have a number of, I guess, streams of working groups working together all to work to get people off the street. First working group is around outreach coordination. So that's the assertive outreach work, getting people on the street, providing education around COVID, providing emergency packs and kits, making sure people are accessing food. A lot of the food services, because they're typically voluntarily run, reducing their capacity. So we're making sure food security is considered in all of this for people on the street as well. The second group is an accommodation supply and placement coordination group. They're focusing on, now that we have 200 properties identified, we want to make sure that we're getting the right types of properties. So our Aboriginal agencies have said, you know, can we get Aboriginal specific hotels where we're just placing Aboriginal people so they can feel more connected with their communities. We've had services requesting that we have female specific accommodations. And so they're focusing on the spread of accommodation and also the types of accommodation that we're getting. The third group is an accommodation support group, and I've been nominated as the lead for that group. And that's really about providing the post-crisis support once someone's put into temporary accommodation. It's really critical that we engage the hoteliers to make sure that they feel safe in providing that accommodation, that the people in accommodation are supported regularly, are educated around COVID, have their food security sorted, and more importantly, a link to, Kim mentioned as well, case management. So we're really keen to see this whole process not just as a temporary stay to keep people or give them opportunity to self-isolate, but as a mechanism to identify need, triage people, and link them into other housing pathways, which might include social housing, but also government here has provide additional funds for rent start options, which are subsidised rental programs for people to be able to access private market rents as well. So that's a really important process that we're undergoing. I think just some practical things that we're doing in the inner city. We have a daily huddle between key assertive outreach teams, and they're there to make sure that we have a finger on the pulse around what is happening. Are more people moving in? Are there issues with sourcing food? You know, identifying the people that might have complex mental health needs that we need to get the health teams in to see. And that's been a really effective service. My time's almost up as well. And look, finally, I guess I'll stop with just talking about some of the issues. We need adequate post-crisis support. So some people will just need a bit of a light touch once they're put into housing, into a temporary accommodation place. But, you know, we do know from street counts, from connections weeks and registry weeks in the past in the inner city, there's a large cohort that will need longer term support over a long period of time. So how we fund that is really critical. Secondly, ensuring people stay housed post-COVID. That's a big fear I've noticed on the questions. Lots of people are asking about what are we going to do with people? You know, is this just a temporary thing? It's called temporary accommodation? Will they end up back on the street? We need to make sure that people are moved into secure housing and then supported to stay there. And finally, you know, the federal government has put in place a situation where people cannot be evicted from their properties for 6 months. That's great for the short term, but there needs to be a lot of advocacy around making sure that a reduction of that is gradual at the end of the pandemic. Otherwise, we will see a large number of people hitting the streets immediately after that, and we're back to square one. I see this as a really good opportunity. Everyone's rallying together, all departments, all sectors. We're getting people off the street. You know, we've got 6 months to get people off the street and figure out the way to keep people off the street. So that's a great opportunity. Thanks.
Thanks, Shane. That's great. And I know that everyone's struggling to cover such a large amount of time, issues in the short time you've got, but appreciate you trying to stick to the time. So Jed, over to you. Jed from the Salvation Army in Tasmania.
Thank you, David. I'll be talking to Shane afterwards about the daily huddle. For the social distancing in that, it's not a daily huddle.
No problem.
Donoghue, Salvation Army in Tasmania. We run a range of homeless services down here as part of the Housing Connect system. Since 2012, we've been operating a street to home worker in Hobart, which we fund ourselves. And over the last 3 months, we've set up a safe night space with Hobart Sea Mission and the Hobart City Council, who provide the site. The context in terms of the virus for Tassie is that we closed the borders early, declared a state of emergency. Unfortunately, we've only got 89 cases. It's been gradually going up each day by about 3, so it's pretty flat. We've only had 2 deaths so far. There doesn't seem to be a community transmission to date, although the Northwest have closed hospitals due to health workers being infected. The challenges for us, as with everybody, of course, is that access to any affordable accommodation for our target group, for our clients, for the people we work with who experience homelessness. That's an issue in terms of social housing supply and in terms of the private rental sector, who in a competitive market aren't interested in taking the people we work with. In terms of the state response to the issue of people experiencing homelessness, and in the context of the virus, we've been asked to develop a statewide response to the situation for rough sleepers in Tasmania. So we've suggested to government, we put a draft to them on Friday, that they consider expanding the current safe night space in Hobart to 24/7 service, and look at setting up operations in Launceston in the North State and in Burnie in the Northwest. So we're in a negotiation process this week with the government to do that. They're looking at people going into isolation or people returning to Tasmania, going into hotels at this stage for 14 days compulsory or mandated isolation. So in terms of the future, unlike my colleagues, I will be brief, because I imagine that after listening for an hour of concentration that you're getting mentally tired. Well, what we need is a national response to homelessness and to the lack of affordable social housing in Australia. Because we can end homelessness, we can definitely end primary homelessness, and we need to focus and concentrate on doing that over the next 12 months. And I think that will do, but hopefully when the borders are open, we will allow all of you to come and visit us, because this is the best state and it's always sunny in Hobart. Thank you very much.
Thanks, Jed. Nothing like a bit of competition between all the states to get us up fired up. Thank you. Right, so we might go to you, Travis, in the ACT, if that's all right. Just need to unmute.
Oh, I just needed to unmute the microphone. Hi, everyone. I guess I'd start by also acknowledging First Australians and recognising that we live, walk and work on their lands, and just pay some credit to our Aboriginal Community Controlled Health Service here, Woonunga, that have stepped up and are doing an incredible job in terms of getting information and advice out to the people that they work for and with, and acknowledge that it was Aboriginal people who were the first people to understand what homelessness really meant in the country. Turning to the pandemic, I think there's some learnings from the Aboriginal and Torres Strait Islander space again, in that for a long time, Aboriginal people and researchers have talked about housing as a social determinant of health, and hasn't the pandemic really brought that home? We've seen the World Health Organization say quite clearly that one of the best preventative measures that governments can take is to ensure that people have access to housing of reasonable amenity that is safe, dry and warm. And that's one of the challenges we're about to face here in Canberra. It's already getting into single digits overnight. And so I'm really pleased to have been invited to be here today in place of Sam Henry, so that she can get on with what Northside do really well, which is their Housing First and other response. And to have been invited by the ACT government onto 3 of the 4 working groups that have been established, I think. The third one hasn't met yet, but the one that is doing an incredible amount of work at the moment is to get people who are sleeping outside indoors as quickly as we can. And so Housing ACT and other providers, including Street to Home, and our axial housing, which probably won't mean anything to people outside the ACT. It's quite a new initiative, and it brings together a number of agencies and health services for a dedicated housing first response. It is a pilot. I think what we would say at ACT Shelter is it's very clear that it takes a secure home to end homelessness. So we'd like to see that word removed from the program and for it to be an ongoing allocation of properties as part of our land release program that is dedicated to permanent supportive housing, because there's very clear evidence, as Karyn and others have demonstrated over a decade or more now, that that is the solution. And so while it's great that we're working and Housing ACT and others are working to identify hotels and motels in the ACT that can take people right now to get them into places where they can adhere to our Health Directorate guidelines, we really need to see, and I think the level of investment that the Commonwealth has been able to make to support people to stay in jobs, to double what used to be the New Start allowance, to ensure that people can make ends meet during this pandemic, shows quite clearly budgets are about priorities. And if it's a priority for government and others to end homelessness, then they can do that. We've seen hundreds of billions of dollars allocated in the last few weeks. So I think the numbers we've heard about from other states show that this is very solvable. And that's what we'd like to see going forward. And so I'm hoping that one of the working groups, which is around identifying longer term options, becomes an ongoing forum for us to work out how we get that supply happening. I think Jed just mentioned a national homelessness strategy. We are very clear here in the ACT, our Chief Minister would probably agree, we have limited own source revenue and we really need a national housing strategy that clearly demonstrates that it is a priority for all levels of government to ensure that this core social determinant of health, it's quite clearly been demonstrated in the last few weeks that it is a preventative and a primary health response to have access to safe, secure, affordable housing of good amenity. And so for us in the ACT, we are really keen to see the Commonwealth get on board and step up and return to the days where we really valued social housing supply as a social good and as a clear pathway out of housing poverty for people that the private market simply prices out. So one of the challenges we face here is we're looking to the private market because we need to get people into homes, and there will be some supply there because we're a university town and there's probably properties here that can't be utilised because there's international students waiting to come, or the market might be a little bit depressed. But the reality is a 2-bedroom apartment in the ACT is nearly $500 a week. So even with the doubled rate of New Start, you would be looking at having less than $100 for every other expense. Subsidised housing needs a subsidy, and we need to really understand that there's very clear cost savings that, again, Karyn, Walsh and others have demonstrated, Paul Flatau through his research. And we're starting to see government get on board with that, with our Housing First axial housing response here, and with the understanding that they're now more interested, I think, in offering things like land tax relief, and we're hoping discounted land for social housing providers so that we can get those housing options out there with long-term security of tenure. Because one of the challenges we face in our private rental market here, for the group I think that we're interested in talking about today, is 6 to 12-month leases. And then what does the person do if the investor decides to sell after that 6 to 12 months? Are they back where they started? And what does that do if somebody's had negative experiences of the service system where they sort of feel maybe the housing promise was a false promise? So I suppose that's a bit of a rant, but I think in the context of the pandemic, we're starting to see some very clear evidence that solutions can be found and money can be found. one of the other interesting things around the need for people to have options to self-isolate in the ACT is we may be moving to an expiation system as New South Wales has implemented. And one of the challenges that ACT Shelter and Canberra Community Law and others see is effectively people are self-isolating in where they're living at the moment if they don't have access to any shelter. So we're quite clearly asking for exemptions from any fines that might be applied for people who really don't have any option to self-isolate until we find those properties that we need to find to get people in a position where they can adhere to health guidance around that. And certainly some of the people that I've had contact with over the last few weeks really do want to do that, but they simply can't because there's nowhere inside for them at the moment. But I'd also like to back what other states have said, and we've seen the sector and government and elements of the housing industry here really come together over the last few weeks and really start to think about what we do after the 3-6 months is over and how we work together to make sure that every Canberran can find a place to call home that has that safety and security, so that it really does deliver those cost savings down the line over decades in terms of net benefits for better health outcomes, participation and productivity. The other working group that I would draw people's attention to that is also really critical is the congregate accommodation and the shared occupancy working group. So we've got a couple of large sites that are for people experiencing homelessness, and they've probably got close to 300 people in dormitory style accommodation across those sites. We have probably, as other states are experiencing, a really critical shortage of personal protective equipment. And if I can make one request to the Commonwealth before I finish, for our workforce that is out there every day and every night supporting people, we really need to see that stockpile of personal protective equipment replenished so that our volunteers, many of whom are older and at higher risk, can return to supporting the paid workforce to do its job. And I'll wrap up there and let other panellists and questions and answers come. But I just wanted to thank the Alliance for inviting me to be here today.
No worries. Thanks, Travis. And a really important point there about the personal protective equipment. I think that's something that's been on the minds of a lot of us at the moment. Fran from Northern Territory.
Yes, hello everyone, and thank you for this opportunity. Just wanted to acknowledge that I'm sitting here on the traditional lands of the Larrakia people, and I pay my respects to elders both past and present. Here in the Northern Territory, we probably are a little luckier than most other states and territories in that we only have 28 cases currently of COVID-19, and there has been no community transmission as yet. So we have obviously had the opportunity to learn from what's happening in other states before it's become a major emergency here. But we do have different challenges, I guess, from the point of view of the remoteness of the region and the fact that we are just coming off our wet season. So there is some challenges in terms of people being stuck in the major centres, like they may have come in from community and have been stuck in Darwin or Alice Springs or Katherine without an opportunity to get back home. So one of the things that we have been working on very closely with a number of different agencies is how do we return people to country? So this is enabling them to get back home and making sure that they are safe to go back home, because there would be nothing more dangerous than sending a person that has the virus back into a very small and remote community. So that's been an initiative that has been quite strongly worked on here in the Northern Territory, is getting people who may be considered homeless but actually have a home elsewhere, so getting them back to their home. We are also very conscious about education. There is a lot of people here that probably don't understand the implications of COVID-19 or understand how serious it is. And a lot of people, language is a barrier. So we have been looking at how we communicate in traditional languages, how we use people who have good English skills but can speak another language to be communicating that message to people in community around how serious this virus is. We've also been making sure that we are linking to other services and ensuring that we are working together collaboratively. And as everybody has said, it is very much a collaborative approach that we have seen. We have our industry groups here with NT Costs and NT Shelter, and they are working together to advocate to the government in terms of initiatives that need to be put in place. We are blessed, I guess, from the point of view that we have two very large accommodation facilities here. You may have seen on the news the Howard Springs facility that was used as a quarantine area. And we also have another site near the airport. They both are complexes that were developed for the fly-in, fly-out workers, and they have approximately 3,000 plus beds in those sites. At the moment, we are not able to use them for housing people, and that's probably initiatives that we are pushing with the government, because we do have the accommodation available. How can we make this accessible for people who are currently sleeping rough during this COVID-19 crisis? One of the other things that we have seen emerging too is we have quite a transient population up here for people who fly in to do the remote work or the work on stations or fruit plantations. So we have seen a lot of sort of backpackers or people who are in a situation where they've come in as a refugee and they're not eligible for the standard payments, and they are not being paid for their work, which was originally planned, because all of that has been shut down. So we are seeing obviously a very high number of our First Nations people, but also an emerging group of homeless people, because they're not able to afford to pay the accommodation as they had planned. And so we are finding that they are sleeping rough, camping, coming into our shelters or coming into our day centre for food. So that is a new dynamic that we're seeing up here in the NT. The other thing that we are very mindful of is the need for, with self-isolation, people being forced to separate. And we've found that some of those people have, alcohol issues, have drug issues, have mental health issues. So what additional supports can we be providing? So that's a discussion that's happening at the moment, and we're seeing some really great work between the agencies for those that might have accommodation services, working with those services that have mental health programs or alcohol and drug addiction programs, to actually look at how we deliver those services to people who are in isolation or people who are in lockdown. So that's been something that's been quite positive that's come out of this crisis. Is we're seeing new relationships forming, we're seeing new ways of delivering services to those in remote communities or those that are in areas where they are in lockdown. The government have been, very strongly supporting all of the initiatives and have made some, major announcements about additional funding. And I am very impressed with the responsiveness. For example, we had put together a proposal for being able to feed people using our commercial kitchen, and that's was something that was responded to within government within 5 minutes of me sending the email to suggest that we could be doing this type of work in a different way. So I think that's probably the main issues here in terms of a different approach and a different way of working. but obviously us having the opportunity to benefit from more time to prepare and having a less number of cases here in the Northern Territory. A lot of people would complain about the climate here in the Northern Territory, but I guess it has worked to our advantage in that the period that we've just been through, we haven't seen as many travellers, and with the heat, obviously we don't see the virus taking hold as much as it has in some of the colder states, for example.
Great, thank you so much, Fran. I think there's some really unique issues there that you covered, but ones that are relevant to many other communities as well. I know the issue of remote visitors is something that's been discussed a lot in South Australia, so thanks for that. We've got a couple last speakers, and so just keep your questions coming online. A few of the panellists have been answering those, and thank you to Minister Howth, who's answered a couple of them as well, in particular the personal protective equipment issue that we talked about before. Minister Howth's offered to provide some support there if you're in desperate need there. So feel free to get in touch with his office. He's put his details in the chat features as well. So thank you everyone for the questions and the answers coming through. And Karyn will ask for an update from you about Queensland.
Hi, I'm going to be very quick in the interest of time and not repeat the things that people have said before. So we've got about 166 people waiting to be housed in accommodation so that they can be inside and can stay at home and do what all of us are being asked to do during this pandemic. But the issues are very much the same across all of the other speakers. Coordination has been important. There's multiple forms of coordination, which is sometimes hard to keep up with. The confusion of people who are homeless or in some of our social housing and isolated. So people with the mental illness and substance use issues, this is just compounding their disadvantage and their exclusion. So it's been really important for us to make sure we get out there and continue to provide services and to get this pathway into housing, because you know, everyone's given, if ever there's a divide that's being created is, you know, for all of us to be healthy, we go home. People that don't have a home can't respond to that. And all of the issues people have raised, I think about, you know, we really hadn't responded to the crisis of affordable housing. And now we've got the crisis of affordable housing compounded with a health pandemic. So I think that, you know, it's been fantastic listening to what everyone's doing, and we're all doing similar things at a different scale. We've only moved 30 of our 166, but we're working hard to increase that daily. We're working hard to give people healthcare and have been able to increase some of the nursing hours to make sure that that education and the self-management of people's health so that they can be diverted from hospital continues. We know that the emphasis has to be on the long-term planning and case management, as everybody has pointed out, but the urgency at the moment is to get people off the streets, and some states have done that quicker than others. We've all got different scenarios, so really that, I think I'll leave it at that, because we've got Paul before we finish. And be great if people take up the minister's email there if they need personal protective gear, because I know that's been a huge issue in the disruption of available services, because people couldn't keep the, you know, keeping our staff safe is of high priority, as well as keeping homeless people safe and healthy. So it's always been a balancing act. I think we've got a whole new vocabulary around protective gear and Zoom meetings and social distancing and all of the issues that our work, we're talking about our work in a completely different way. So we just need to keep up the focus that housing is both a healthcare issue and a human right issue for people to have a home, particularly during these days. So I know that Paul is the next speaker, so.
Yeah, Paul, do you want to, so we've asked Paul to be on the line. He's a researcher that I'm sure very many of you know, and he's done a lot of work already in this space, and I thought it'd be very valuable not only for Paul to be part of this call, but for you to hear a little bit about some of the work he's doing and how and some of the common themes he's able to draw together about what we're hearing today. So Paul, you want to say a few words and then we'll go to questions after that.
Right, and I'll be brief too and acknowledge that I'm on Whadjuk Noongar land. And in terms of language, I used to think that PPE was philosophy, politics and economics, but now I know otherwise. So I'm up with the new lingo. So just two basic things from today. I mean, first of all, just what a tremendous response we've had. It's agile, it's been fast, it's been coordinated between different levels of government and the homelessness services. So we've just done a quick tally in terms of the services that have been speaking today, and 750 people, 750 rough sleepers across Australia have been housed in temporary accommodation that we know, and the figure is likely to be higher. So that's tremendous work, and we also have seen how those that have had a by nameless structure and have used this thing called the VISPAT Act, which enabled them to understand who had high health needs, were able to react very quickly. So that Advanced to Zero program really has placed a lot of services in a very good position. We've also seen agility in terms of outreach. So a number of services had to close, but there's been a coordinated response to replace that. So that's been an outstanding result, I think, and that's meant that so many rough sleepers are in a better position than they would otherwise be. So that's fantastic work. So I just listed 10 quick challenges and I'll just zip through them just like that. First of all, the challenge of new entrants. So Karyn has spoken about a couple of people who are coming in around the newly unemployed. We have to be very careful about that and be agile to respond to their needs as well. And in that sense, it's an economic response, which the federal government has done brilliantly, but also a housing response on moratorium on evictions and rent support. And in that area, I know that legal aid is currently stretched. So we really have to make sure that we prevent homelessness in the first place. I think there's been some interesting questions around the exit strategy. And I thought that the response in South Australia, for example, and what we've seen in New South Wales today, really shows that, yeah, people are thinking about that exit strategy. So in South Australia, there will be that strategy of moving people into permanent housing. That's what we need. We've also seen the need for a culturally appropriate response around Aboriginal housing. And that means that we just need to be very careful that we house people in the right kind of areas. Great response in terms of PPE from Minister Howarth. And I think more generally, if we can just make sure that all of those working in homelessness services are recognised as essential workers, as emergency workers, that would be good. I think that's occurring in different states, but I think just a general blanket, yes, that's right. There are some other challenges though, and I think, for example, our research around entry into homelessness, half of those who are currently homeless, half of those on the streets and other places started that journey before the age of 18 in local areas around those suburbs. And we have to be really careful about all of those young people who have been couch surfing and doing a bit of rough sleeping and then going back into homes. It's usually because of a family domestic violence issue that we look after those young people who are currently rough sleeping out there in the suburbs. That's a coordinated response with schools as well. And we need to make sure that this response that has been largely city-based moves out to all the regions. It's been a tremendous response, and I really congratulate everyone involved. You've done a great job for those experiencing homelessness, so well done. Thanks very much, David.
No worries. Thank you, Andrew. Well, I might just go to our first questions if we'll jump straight in, and panelists, if you want to, put your hand up or just jump straight in about questions. So we've had one from Alana Wright, who's from Mount Isa, who said that last week we had 161 individuals rough sleeping in our community. What are some of the options for accommodation when hotels, motels, caravan parks are closed? Does anyone want to jump into that one?
I'm here.
Karyn, thanks.
I would suggest talking to the Department of Housing, because the government may have a way in to work with those hotels or motels that are closed.
So speak to Department of Housing about that. I think it's also about the critical mass.
No worries.
I would agree. In South Australia, the response from hotels has been because we've reached them early before, their viability has been at a very challenging place where they're having to close. So I think the sooner we can reach out to those hotels and motels as an option. This is it's a terrible situation, but it is a once in a lifetime opportunity in some ways, where we've got such vacancies across hotels and motels. Yeah.
Thanks. We've got another one here. So what would your advice be to health services, mainly hospitals, in addressing homelessness, and how do we make sure they don't discharge people at this time into homelessness?
Shane here from New South. We work closely with the inner city hospitals, Royal Prince Alfred, Prince of Wales and St Vincent's Hospital, and my video on. And that's something that they've raised all along. Technically, hospitals don't discharge to homelessness. They discharge to Link to Home in New South Wales, which is a service which might give them a couple of months accommodation. But people do find their way onto the street. So we're looking at how do we get some government representatives either coordinating with the EDs and the hospitals directly to fast track people that are homeless out of hospital discharge, and also the Link to Home service in New South Wales is working to have I think it should be live now, a fast tracked, streamlined sort of application form, I guess, if you will, for social workers in hospital to be able to make that link a lot quicker and to be able to stay connected into TA.
Great. Anyone else want to jump on that? That's good advice, Shane.
It's a great opportunity to have hospitals as part of our coordinated response. Yes. And I think that, some states, Perth and Melbourne and New South Wales and Brisbane, we've all been trying to strengthen those relationships across sectors, that it's not just the homeless sector. And I think that, in relation to just the work that we're trying to highlight with the housing and homelessness paper that we did, Leaving No One Behind, was exactly to strengthen those relationships. And I know plenty of organisations have been working on it. We just want to lift that up so that it's seen a lot more and the value of it's seen a lot more. It's not that we've got to work on it together, because often people need clinical support when they're discharged, and how do we make sure they get that? So whatever coordinating elements people have in their local community to include the hospital social workers.
It's just Shane here again. I'd add one more point as well. While we're early days in the by name list methodology in New South Wales, we just need to remember that that's about a systems approach to tackling some of these issues. And so there's a number of, by having the Premier's department involved, it makes it a lot easier to have those conversations with, say, corrective services as well, which has a similar issue with discharging people and then them ending up on the street. Having government at the table is really critical.
Agreed, and I think in South Australia we've got some coordination mechanisms where we have the hospital avoidance team at the table, we have the drug and alcohol team, mental health teams, those sorts of things. So they all participate in weekly case conferencing and fortnightly housing allocation meetings and those sorts of things. So that's the mechanism for us in South Australia. I don't know if Kim, you wanted to add any more to that.
Yeah, that has been critical in this response. The hospital avoidance, look, we've all got a collective goal to keep people away from hospitals. We know we need to keep that space clear given the pandemic. And also for those people that are in hospital, to find pathways to discharge people, whether it's into the motels, the hotels with supports wrapped around them. In South Australia, there's also a trial of a crisis, of a respite facility that is enabling people to leave the Royal Adelaide Hospital and move into the Baptist Care crisis respite facility for a period of time while they stabilise outside of the hospital. So I think it's a collective effort with using all of our resources that we have available.
Victoria has a great program where they have a private rental subsidy scheme for people to keep them out of hospital as well. So I might jump to another question we've had from Shannon Faulkner. Has anyone had any difficulties in terms of responding to under 18s in this current crisis? Rough sleeping.
Yes. We haven't found the solution to that. We haven't found the solution to that yet. Obviously, they would need to be accommodated with an adult. So it's in the mix of how can workers be rostered on if people were in a collective, in a one hotel or motel, or a set of apartments. It's really, it's in the mix as every population group is, because every population group has different needs. So I think that, today's been fantastic hearing what different states are doing, and maybe we should do it again and share the problem solving that's going on and what are the solutions that you're coming up with, so that we can all share that in our local areas or state areas. And it's fantastic that so many people have taken the time to be part of this, and that from the questions, there's obviously a lot more to discuss. So, certainly.
Karyn, there's one here that says, where do we get a copy of the Leaving No One Behind reports?
On the AAEH website, I hope.
We'll make sure it's on there. Colleen, you asked that one.
I'll double check as soon as we finish, but I'm sure it's there. And we also want to, have an Australian network for health, housing and homeless, so that so many of these great initiatives that we hear about and that are, transferable to both regional communities and to capital cities, that we just need to highlight that. So that they're both things that we need to do during this crisis, I think.
Good. Thank you, Deborah Wilkinson, for posting paper. That's very helpful. Also, we've got a question here from Deb Stafford saying, we have a local Byron Shire sector support program for the establishment of a by name list, but we don't have one already. Do you think now would be an appropriate time to get cracking on one?
Yes.
Yes.
Yeah, okay, thank you. Fran, in the Northern Territory, are there any remote communities who have closed and are not allowing people to return to country from Darwin? If so, how would you support remote visitors in the city to stay safe? Catch that one, Fran?
Yeah, it is. There has been quite strong closures of those entries into remote communities. And as I said, what we are doing is working with Larrakia to try and get as many people back to their own community. And emergency workers are, on special request, able to go into those communities, but they are very much trying to keep those remote communities safe and making sure that they remain healthy. So they did do that quite early in the piece by locking down access to remote communities, except for emergency type workers. Even now, emergency workers, it is special requests to be able to get into the remote communities. And, being able to look at people who are here in Darwin or in some of the other major regional centres here who are not going back to community. And in most cases, it's their choice, because there is a very strong push to get them back to community if it's safe for them to go back. So we are looking at how do we keep those people who have chosen to remain here in Darwin or other regional centres, how do we keep them safe during that period? And that is a big challenge.
Thanks, Fran. I've got a question here from Sue, who says, local government's role in assisting people in this crisis, what should it be? We have many local governments beyond our capital cities that are working in collaborations and want to help. What's the advice of the panel for people involved in the local government sector?
I think one of the things about local councils is that they can see people who are locally based, if you like, and they're much more connected to, say, the youth homeless group as well. So whilst a lot of the services that are here have been very much inner city based, the councils in very many parts of Australia have been developing their own policies in regard to that group. It needs to be coordinated, so rather than the council going off on its own, it's really good to connect into homelessness services, to youth homelessness services, and depending on the kind of issue, for example, if it's youth homelessness, then you need the schools, youth homelessness services and councils all to be working together, so a coordinated response.
Thank you.
Obviously, absolutely a role for local government. Just over the border in Queanbeyan, the Queanbeyan-Palorang Regional Council are very actively involved and have a couple of reference groups that they work with to assist them to develop a coordinated local government response to youth homelessness, homelessness for single adults, and as it emerges in the region. So yeah, absolutely a role for local government.
Yeah. David, I'd concur with that. Some of our closest partners in ending homelessness in Melbourne are the councils. They represent community, so they've got a unique voice. They've got a unique voice, and they can, when they work well with us, they can really initiate a lot of conversations with people that we don't get access to. So really pivotal.
And we found here in the NT that the work of the local rangers has been really critical in that communication and enforcing the social distancing, etc. So the local council have played a really key role in keeping people safe and communicating the message as well.
Yep, just from New South would just reiterate all of those things as well. Really critical. Local councils can play a massive role in public perception as well, in laws, local laws, in relation to move-on laws, in relation to improvised dwellings and how people can support people that are maybe don't have the means to rent somewhere. So huge support, but it needs to be coordinated.
John here in WA. John here in WA. Yes, look, the local councils have become active participants in the end homelessness space. In very much they're part of the outreach process, and so they're cooperating and working with us, particularly through the rangers. So when we do outreach visits, it often can include local government at times, or help identify where are the hotspots and where people are gathering. They're also coordinating our volunteer services, so many of the food and other support services who are activated through volunteers has been basically coordinated through the City of Perth. And we're also now talking to the West Australian Local Government Authority as the peak organisation to help develop a local government kit to help all local governments, and there's 139 in Western Australia, to develop a response to housing and homelessness.
And I just reiterate, in Adelaide, the City of Adelaide have been a really critical partner in the Adelaide Zero project, have invested significantly in supporting that project, and also particularly engaging business and the community.
Rallying that extra support and resources. Yeah, great. Well, thank you, everyone. We're running a bit over time, but I just we'll ask you one last question, if that's all right. And we're very lucky that Minister Howe's been on the call today. So can I just rattle off each of you to very quickly say, if there's one thing you'd like the Commonwealth Government to do what would it be? And just if you can go, just keep that short. So in order of who's in front of me, I'm going to start with you, Paul.
Well, we said prevent, house and support in our policy response. So prevent, house, support.
Great, thank you.
One sentence. One sentence.
Thank you. That's awesome. And there's a great paper that you've put out on that. Karyn.
Oh, well, I'm going to advocate that we have more linkage between healthcare and housing and homelessness. And the Commonwealth could be a lead in that, because we know it's all about state Commonwealth agreements.
Yeah, great. Consistency there. Thanks, Karyn. Travis? Were you on mute? Sorry. We'll come back to you, Travis. Fran.
No, I have a quick one. Work with National Shelter to lead a national housing strategy with clear goals and targets.
Yep. Fran?
I'd like to see any innovation or new initiatives that come out of this forced way of looking at homelessness in a different way continue beyond COVID-19.
Great. John?
Look, I would reflect the sentiments of a national housing and homelessness plan.
Thank you. Kim?
Yes, taking what we learn through this process, and when we're treating rough sleeping as a state of emergency, what can be achieved collectively with the community, government, non-government. There are solutions that I think, you know, we could really learn from in this process. All of us, we're all a part of the solutions. This isn't just government. I think we're all part of the final solutions, but learning from this particular experience.
Thanks, Kim. Shane?
Yeah, look, housing as a human right enacted. As Australians, we're really on board with universal healthcare. We have our safety nets around that, and everyone's on board with that. Everyone can access that. It's about will and the will to do something. So we have this great opportunity. If we're going to get everyone off the street that wants to be off the street and supported and connected and moved into long-term housing, let's use this once in a generation, in a 100-year opportunity to stop it there and say, that's it. Change our systems so that no one else goes on the street.
Great. Jed?
Well,
come visit you in Tasmania.
Yes, as has been said before, I think this is an opportunity to end primary homelessness.
Andrew, anything you want to answer on, given you started off first?
I'd like to treat social housing as critical social infrastructure, the way we treat schools, hospitals.
Great. Okay, and one point from me is I'd like to see support for Australian communities to establish these by name lists, because we've shown how demonstrated how critical that's been. So greater support for doing that, I think, is really important, and that's what this crisis has shown. So we did cover, Paul, we mentioned the health, housing and homelessness network that we're keen to set up. We'll send some more information out after this call with the video of this call, with some extra resources and a few other things, but including information about this health and homelessness network. We're keen to get it going. If people are interested in being part of it, please get in touch. We're interested in people who are wanting to volunteer to be part of this network. We're looking for a group of people who want to help to organise that and drive this forward. And we're really lucky in that we've got the Canadian Alliance to End Homelessness, who's established a similar network, who are willing to support us to do that. As I said, there's a few extra resources here. One way to stay connected in these strange times where we're all sort of working slightly in social isolation, social distancing, and other things, is to stay connected through social media. And we've set up a Facebook group for ending homelessness. So the link will be in the email that you get after this. Encourage you to join and share the stories about what you're working on there. It's an informal way of sharing information that we're all working on. I've put a bit of information here about some of our partners from different organisations around the world. There's some great resources out there. Please draw on them. This is a challenging time, so please look after yourselves. There is support services out there, and make sure you avail yourself of those, and your staff do as well, because this is really challenging time. And I wanted to end with a bit of a message that we've received from our friends at the Canadian Alliance. They say, start where you are, use what you have and do what you can, but most importantly, never give up. We're doing such important work out there at the moment. So thank you everyone for the work you're doing. Thank you to the Minister for listening in today. Thank you for our panellists for being fantastic and letting me put you on the spot and working through everything and dedicating so much time. And thanks again to the Micah team and 50 Acres for helping us out with everything to get this whole session working. I think it's worked really well, and we'll be in touch about future sessions. So thanks for your time. We look forward to talking to you, and stay safe out there.
Thank you.
Thanks, David.
Thanks, everyone. Thanks, Minister.
Thank you.
Thanks everyone on the panel.